Hi everyone, thanks for joining us. My name's Rosa, I work for Fertility Network. We're really lucky today and we're being joined by Rachel Cutting, who's the Director of Compliance and Information for the HFEA. Before we start, I wanted to say thank you so much for all the questions you've sent in. We've had tons of questions. Unfortunately, not all of them were relevant for what we're going to be talking about today. So what I would say is if you had a question about your treatment or your specific clinic, the best thing to do is to get in touch with them directly, because as far as we understand, clinics will have different ways of managing what they're opening, how they're opening and what they're prioritising. So if you do have questions about your anything that you want to talk about to do with your emotional side of IVF, please do call our support line on 01424 732 361 on Monday, Wednesday and Friday, and we can help you by talking through those emotions with you. So over to Rachel. Do you want to give a quick introduction to you and what you do?
Yes, thank you, and thank you to everybody for joining us. I joined the HFEA in November as the Director of Compliance and Information, so I oversee the inspection team and how we regulate clinics, and also about how we collect data and share that as well. Before that, I was an embryologist. I worked in a fantastic team in Sheffield for 25 years, so it was a very difficult decision to leave there and join the HFEA, but I just felt it was the right time to do that. So exciting and challenging new role for me.
Well, thank you for everything you've done before joining the HFEA then, as well as now that you're at the HFEA, and thank you for taking the time to answer some questions for us today. So I think we'll start, shall we? So our questions, you may recognise your questions, some of them overlapped, so we did combine a couple of them. So first question, will PPE be changed in between each patient or just gloves and hand washing?
So ensuring the safety of patients and staff is obviously going to be paramount during this time, and there are very detailed guidance from Public Health England which have been incorporated in the professional body guidelines. So they're the professional bodies, the British Fertility Society and the scientific professional body as well, that have joined together, the BFS and ARC, to produce guidelines. And what would we would expect clinics to follow those really detailed and comprehensive guidelines, and it depends on the procedure. It even talks about what you should wear for a scan, what you should wear for an egg collection, embryo transfer, what you should wear meeting and greeting patients in a clinic reception, for example. So of course, if you're doing hands-on direct contact with patients, all that PPE should be changed, the gloves must be changed between patients, but there is very detailed guidance for clinics to follow which will reassure patients that they will be kept safe during that time.
Yeah, that's great, thanks. Can you provide an approximation of when we can expect clinics to reopen?
So the decision was made by the authority that clinics could apply to reopen from Monday the 11th of May. And that was a decision that was taken very carefully by the authority, looking at various different aspects to make sure that we could make sure a service could open safely. So what happens now is, if a clinic is ready to open, and that is an if, not every clinic will be ready to open because it depends if staff have been furloughed, redeployed into different parts of the hospital. It might mean even equipment, ventilators and flow hoods might have been taken elsewhere. So it really depends if the clinic is ready. What they have to have is a treatment commencement strategy, which puts everything together to make sure that they can then open safely. And they've got to look at every aspect of their treatment, every aspect of their procedures and processes, and look at the risks and make sure measures are put in place to minimise those risks. So a clinic's got a lot of work to do before they can even apply. Once they've applied, they fill out what we call a self-assessment questionnaire, which is 50 detailed questions that shows us that a clinic can work safely. Now, the inspectors are working really hard, and when they get one of those self-assessment questions back, they'll make sure within 5 working days, if we're satisfied with everything, that that clinic can then reopen for treatment. At the moment, we've got 54% of all clinics have applied and have successfully been able to reopen. Slightly more private centres than NHS at the moment, but there are some NHS centres in there that have opened as well.
Oh, great. So how long until patients can expect that they'll be able to start their treatment?
I think that's really a decision for individual clinics, and I would definitely advise patients to contact their clinics about that, because it may be that some clinics prioritise patients, say patients with a low ovarian reserve, and do those first, or it might be that they do different treatments to start with. So some might start with a few IUIs or frozen embryo transfers and maybe move on to egg collections later on. I think the best thing, contact your clinic, be patient. We are obviously very early on in opening and starting to do treatments again. It's a learning curve for everybody and working out how they can manage their service safely. So they're going to have to really cut back on the numbers and take it steady to start with. So talk to your clinics, but be patient, and we'll get there.
And the new guidance, how is that going to be monitored?
Well, at the moment, we can't actually go into a clinic to do inspection. That wouldn't be appropriate for inspectors to go in, but we will monitor it really closely. We have a team of inspectors who are each assigned a clinic to look after, and they have very good close working relationships with their centres. And we've obviously seen how they're going to work and operate with the self-assessment they've done, and we've asked very detailed questions in that. But we will be monitoring activity levels of centre. So when a patient starts their treatment, a clinic has to submit data to the HFEA, and we'll be monitoring to make sure that the activity, the number of treatment cycles, is sensible at the moment, because we would expect it to be less, especially in the early days of redoing that. We've asked clinics if they have any positive COVID-19 cases, either in patients or staff, to report that to us, so we can keep a close eye on that. And also incidents, if anything happens in a clinic, even a near miss, and we'd expect that with anything that's happening at the moment, they are entitled, they must report that to the HFEA within 12 and 24 hours. So we do take it very seriously, and we will monitor the situation very, very closely to make sure patients are kept safe.
Yeah, that's great. And then, so with the patients themselves, how will they get tested prior to commencing treatment? And will they get tested, even if asymptomatic?
If patients are asymptomatic, the strategy for testing isn't really there in the UK at the moment. It's a little bit unreliable if you are asymptomatic, and it's not something that is widely available at the moment. Clinics may take their individual decisions to test their patients, others won't, because that's not in the guidance at the moment. What will be important is screening questionnaires and what we call triage. So every time you visit a clinic, you'll be asked whether you or any members have been diagnosed with COVID-19. Have you had any symptoms in the last 2 weeks, such as fever, persistent cough, loss of smell, sore throat, or if you've been around anybody else who's had these symptoms in the last 2 weeks. And those questionnaires will be taken very seriously by clinics, and they literally will need to fill them in every time you visit. And they'll also look at the history of where you've been over the last 2 weeks before you had treatment. The BFS and ARCS guidance actually maybe suggests that clinics should suggest to patients that they self-isolate up to their egg collection from when they start stimulation. And I know that's been in the press this morning, hasn't it, about elective surgeries starting, that patients are being asked to self-isolate for 2 weeks up to the date of the surgery. So I would talk to your clinics about that, ask them about whether they are doing any testing, ask them about the triage questionnaire and any extra precautions that the clinic would want you to take before you have your treatment with them.
That's great, thanks Rachel. And what about the staff? Are the staff getting regularly tested?
Well, staff are key workers, so if they show any symptoms, they are eligible for testing, and there is the government guidance, and definitely staff in clinics should be familiar with how testing can be booked. What we've done in the guidance and the self-assessment questionnaire is asked staff again to do their own triage questionnaires to make sure that they are in a safe environment and they're minimising the risk of transmitting COVID-19 when they're in clinics. And they would be subjected to the normal guidance that if they do come into contact or any family member shows symptoms, they would have to go into quarantine and self-isolate. So clinics have built that all into this commencement treatment strategy that they've got. So the staff will have training and make sure that they are aware of what to do if they do have any symptoms and how to get tested if needed.
Because just another question, if the staff were to have positive testing, how would that impact on the unit, or what would be done?
Well, as I mentioned earlier, we would expect the clinic to report that to the HFEA, and then they would have, the clinic, obviously it's difficult, but they have to put the safety of the patients and the other staff first.
Mm-hmm.
So they would have to look at how that staff member has integrated and been involved and mixed with other team members, work out whether anybody else needs to self-isolate and how the clinic could function, because you do need to have safe staffing levels to be able to operate in an IVF clinic to make sure that it's safe to do so. So although it might be incredibly disappointing for a treatment to be stopped because of a situation like this, it would be the right thing to do to keep patients and staff safe. But what we have asked clinics to do is have reciprocal arrangements with other clinics. So if your clinic for some reason couldn't proceed, it was an emergency because of an infection, then they do have reciprocal arrangements with another clinic who may be able to help.
Oh, that's really great news. We've had a suggestion, is it possible that units might put something into place like a Rotary system where there are two groups or two teams, so if one member on one team tested positive, they could run on a limited clinic using staff in the other team?
Yeah, that has been suggested in the guidelines produced by professional bodies. Obviously, it depends on the clinic and the amount of staff that they've got and how they can spread staff out over the working day with that. So yes, if you could split the team in half, that would be brilliant, but it might not be necessarily possible. But what clinics will be doing is looking even at when staff take breaks, how they get changed, how they come into the unit, maybe splitting how they work in the lab into teams, not necessarily everyone, so that they can minimise the contact between people in the clinics. And they really are looking at every detail around that, and not just about splitting the team into half, but how they use corridors, how they might use a lift, how the waiting room is going to be made so it allows for social distancing. So I think patients can be reassured that clinics are really looking at the fine detail into this and making sure that contact between patients and staff members and other staff members are minimised wherever possible.
Yeah, that's great. How often is the HFEA guidance going to be reviewed, or does it depend on the rates of COVID?
We review the guidance obviously frequently. We're in touch with the Department of Health and Social Care. We will obviously meet with the authority. We've had lots of emergency extraordinary meetings at the moment, so we can feed back to them, and we would do if there was a change. We would also look at the professional guidance that has changed frequently over the last few months, and the HFEA has been able to respond quickly to that guidance and make decisions based on that. If the guidance changes, we would pass that on to clinics, and we have got to monitor the rate of COVID-19 infections and monitor it carefully, and any decisions would be taken by the authority if needed, but we will regularly review them and keep up to date.
Yeah. Is there a system put in place for patients and clinic staff to report if they feel that safety is being compromised in a clinic, for example, lack of PPE?
We do have a dedicated inquiries line that either patients or staff can use, and we've had lots of patients and staff using that over the last month, and that comes through directly to us. But we are thinking of having a dedicated email for anything that does arise from concerns, because obviously we're not inspecting clinics at the moment, and we would encourage, if staff or patients had concerns, that they should contact us, because we would take it really seriously. We've allowed clinics to reopen, but we expect them to do it safely. And how the law works is that each clinic has a person responsible, and they have signed their self-assessment questionnaire to say that they're going to put all these measures in place to keep staff and patients safe. Now, if that's not the case, he would be failing, or she, in their duties to ensure that proper equipment is being used and that practices are suitable. So if that was proven, we would take regulatory action on that. So I would definitely encourage, if anybody's got concerns, please don't hesitate to get in touch with us. We do have a whistleblowing policy for staff. We do deal with patients' complaints frequently over a wide range of issues. Sometimes staff in units are familiar with their inspector and will talk with their inspector. I'm quite happy to do that. And, you know, I did work in the sector for a long time. I was involved in the professional bodies and various things. And lots of staff in clinics do contact me as well and talk things through. Quite approachable, and I would still encourage anybody, if they want to speak to me, to speak to me.
Oh, that's great. We know there's a list on the website of clinics which are now able to open. Is there a list where we can see which clinics have applied to reopen?
We haven't put the list of which have applied to reopen. We have just put the list of when they are open. And that's because clinics may apply but not be quite ready yet, and that would be unfair to put the pressure on them to do that. It takes time to get all the procedures and protocols in place to be able to reopen safely, and some might just want the self-assessment questionnaire to help them do that and take their time and make sure it's right before they're open. So check the HFEA website for those that are definitely open, but please do contact individual clinics because they might be able to give you a little bit more of an indication.
Yeah. This is a specific question, but we both felt I think it was relevant. I'm currently entitled to 3 rounds of IVF on the NHS, and I'm waiting for round 2 to be rescheduled. I wondered if there's any guidance on what would happen when clinics reopen and you have started treatment, or if you either contract COVID-19 and have to self-isolate, or there is a second lockdown and treatments are cancelled or paused and therefore cannot be completed. The round of IVF, would there be another round of IVF offered, or would the round be cancelled and count as one of your 3 rounds?
The funding situation in England is quite complex, and there's lots of CCGs that work with individual clinics, and everyone can be different. So I think with that question, I'd really say go back to your clinic and ask that question specifically. And I think before you even embark on treatment, these are sort of questions that you should know, because it may happen, and then at least you will be prepared and know what's happening with the funding before that occurs. But yeah, talk to your individual clinics on that one.
Yeah, and I think this leads quite nicely into this question. Could clinics close again if R rate rises and COVID cases increase?
That's about reviewing the guidance from the government carefully, and especially I suppose on the government's travel and social distancing restrictions. And if anything did change, that the R rate did increase and we were concerned, that would then go back to the authority with a paper, and then a decision would be made. You know, we do want to treat patients as many as possible and reopen, but it's got to be done safely and safe for staff and patients. So it is a case of that we will keep reviewing it. Hopefully we'll be fine and we'll be able to keep clinics open and get patients treated, but we've got to do that the right way.
Yeah, and I think this probably answers this question as well. Is there a contingency plan for clinics if a second surge of COVID does happen?
So again, it would go back to authority. When we decided to shut clinics in the first place, we took 4 things into account: the government restrictions on social contact and travel, the impact of fertility treatments on the NHS, and if there was any burden that would place on the NHS, evidence on COVID-19, if there was any impacts on pregnancy or any issues around that, and whether clinics could provide a safe service. So I suppose the contingency plan would be to keep looking at those four and making sure that we're satisfied that everything is still okay. If it changed, then we would go back to the authority, and then a decision would be made to whether anything we should do something like we did a few months ago. But they're the things that the four things that we're using, I suppose, to gauge whether clinics can stay open.
Yeah. And what about if a patient develops COVID-19 symptoms during a treatment cycle? Is the treatment halted at that point?
Depends, I suppose, where they are in a cycle, and this would very much depend on an individual clinic's protocols. There is some guidance that was very good that the BFS and ARCS produced. I suppose if you've not really started treatment or you're in stimulation, then it may be that your treatment is unfortunately cancelled and that you would be asked to self-isolate. The difficulty is, I suppose, is if you've took your trigger injection, for example, for your egg collection, I think then the clinic has to very carefully risk assess the impact of treating you safely or not doing an egg collection. And I think that would be a difficult decision for the consultants and the team to make in the unit. If you've had your egg collection and you start developing systems and your embryos are being looked after safely in the lab, then maybe a freeze-all could be done, because it wouldn't be appropriate with somebody with symptoms to go into a clinic because of the risk to others. So again, that's another question maybe to ask your clinic when you do start thinking about embarking on treatment.
Yeah, and I think this is, you've previously answered this, but so if a patient develops COVID-19 whilst waiting to be seen as unable to go forward for appointments at that time, how will they be fairly reallocated to the lists?
I think that's really important that you ask your clinic those questions, because it is a possibility, isn't it? And it's best to know that before you start treatment, exactly what happens if you are cancelled, how they're managing their waiting lists, how, for example, would you be refunded if you paid self-funding or privately for that. I think the more information you can get up front and the more questions that you ask, then the better for you, better for you, really.
Yeah. Someone asks, it's been mentioned that to go ahead with treatment, a COVID test would be needed for both me and my husband, and that would be chargeable. Can you confirm what the cost would be, as this is something that's required by the HFEA, not the specific clinic?
Testing for COVID-19 isn't mandatory from the HFEA point of view, and it wasn't in the British Fertility Society and ARCS guidance either. They did stress that the testing is not widely available and can be unreliable at the moment if asymptomatic. That may change. It may be next week we've got a brilliant test and everybody is going to be tested. So we would expect clinics to react to that. This sounds like more an individual clinic's decision, and obviously that is for a clinic to decide if that's what they want to do, but it isn't directed from the HFEA. That, I think, again, ask your clinic, make sure you know of the costs up front, asks for cost of treatment plans, so it details all the different testing, and make a decision if that is something that you want to do, have the COVID test.
Yeah. And how long will it take from application to approval to reopening? When can we actually expect clinics to reopen?
So, as I think I explained at the beginning, if a clinic wants to reopen, they would ask their inspector for a self-assessment questionnaire. There's a lot of detail and questions to work through in that, and it requires them to evidence every part of that, whether it's how they're going to do their working rotas, how they're going to manage the PPE, have they redesigned the waiting room, how they're going, there's 50 detailed questions to reduce the risks there. And they've got to provide evidence for that as a reference that we can ask for. So it depends on how prepared the clinic has been during the shutdown, whether they've done work towards that then. It depends who's working in a clinic and how quickly and vigorous they can be with providing that. We've had quite a few that have come to us that we've wanted further clarification on, so we've sent it back and worked with clinics to make sure that everything is in place properly. We've aimed to do that within 5 working days, the inspectors, but if there is more information needed or we're not quite happy, that could be longer. So I think it really does depend on the clinic. Some will be ready to open before others, and although we've said 5 working days, that may be longer. So again, check the website, the HFEA, for those that are open, and then contact your clinic individually to find out what their plans are and where they are with the work that's needed to be done to reopen, because it depends very locally on certain circumstances where the unit's located. For example, if you're on high up in a hospital and you've got to use lifts, that's very different to a standalone clinic maybe that's on a got parking and everything around it and a single entrance. So there's lots of things to take into account for individual clinics.
Thanks so much, Rachel. From our team, we just wanted to say, thanks so much to the HFEA for working so quickly on this, and it's so lovely to see that clinics are actually going through this process really quickly and the reopening. So I would say to anyone, I know it's really difficult, and if there's anything that the Community Network can do, just have a look at our website and you'll see on there our info line or our support line. But I would say any specific questions about your treatment, head to the clinic and ask them, because they will have their own rules and regulations. But again, thank you so much for joining us today, Rachel. This has been really helpful. I'm hoping that it's been helpful for everyone that's been watching as well. So yeah, unless there's anything else that you wanted to add.
No, it's obviously we've worked as hard as we can in the HFEA. The team have worked around the clock to be able to turn these the questionnaires around for clinics to reopen, and we just want to do it in a safe way so that patients can get treatment, but be patient with clinics, and obviously use yourselves and your counsellors for support wherever you need it.
Yeah, thank you very much. Thanks everybody. Thanks, Rachel.
Thank you.
Bye.